Good evening and welcome to the PharmAssist virtual learning experience. Before we get started, I'd like to read this very brief disclaimer that you should see on your screen. The PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I'd like to thank you all for coming tonight and welcome. My name is Craig Orpello and I'll be your host tonight. And this is the PharmAssist Virtual Learning Experience, an educational program brought to you by Mandel's Clinical Pharmacy in order to bring you together with outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program does take place every Monday night at 7 p.m. Eastern Standard Time, which is why you found us here. Tonight, we'll be providing you with a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. So we hope you brought your questions. We are joined by amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in the clinic. So I would like to say that you are joining us whether through Zoom or Facebook Live. You can share all of your questions right down on the bottom in the chat or in the Q&A section on Zoom. And I want to say right now, thank you so much to our very special guest who is joining us tonight, Karen Hammond. I'm going to turn it over to you now, Karen.
Thank you so much, Craig. And thanks to all of you for joining us tonight. I love this PharmAssist program that Mandel's Clinical Pharmacy has put together. It gives you a chance to talk with healthcare providers from across the country. Each night, it's a different one of us, each Monday night. And we just want to make this very easy for you. When you first get in to see your provider and medications have been ordered, it can be very intimidating. And we want to make it less intimidating for you and let you see that you can do this. Again, I'm Karen Hammond. I'm an OBGYN nurse practitioner with a doctorate in nursing practice. And I practice in Birmingham, Alabama, where I have been in reproductive medicine now for just over 3.5 decades. And it's my honor to have you here tonight and to make this easy for you, answer some questions that you may have, and talk to you about 3 products. The products I'm going to talk to you about tonight are Menipure, Progesterone in oil, and finally, Avidrel. Your doctor or healthcare provider may have prescribed one or all of these medicines. May not be that you've been prescribed any of them at this point, but some of the injection techniques that I will talk with you about hopefully will make this very easy for you. So we'll start out talking about the first product, and it's called Menipure. Menipure is commonly referred to as a gonadotropin. It's human-derived, human menopausal gonadotropin. And it contains 2 hormones. One is FSH, which is one of the few hormones that does exactly what it says it will do in its name, follicle stimulating hormone. And it stimulates the follicles to grow. The other hormone in this medicine that kind of differentiates it from some of the other gonadotropins that are out there is LH, luteinizing hormone. And this can help you if you are on particular other medicines to suppress your ovulation, or if you have a low body weight. I think those are the 2 times that I most frequently will prescribe this medication. But your healthcare provider will tell you if it's the right one for you. So this medicine does have to be mixed. It's administered subcutaneously, so meaning in the fat. So let's go ahead and have Craig cue up the video. And I'll walk you through step by step exactly how to do it. And then on the other side, I can answer any questions that you have just to make sure that you understand exactly how to do it. Craig, you want to start the video? I'd like to talk with you about administering Minipure. If your prescriber has recommended that you take Minipure, it's given subcutaneously, which means in the fatty part of your skin. You can either generally give it in your lower abdomen or in your outer thigh. It's quite easy to mix it. It does take a few steps though. You need to start by taking a look at what your dosage is. Each bottle of the powder of Menipure contains 75 international units. So if you have been prescribed 150 units, you will need 2 vials of the powder. No matter how many vials of powder you'll still just use 1 cc of the liquid. So I like to start by opening up the tops from all of the bottles. So we're going to do a demonstration today for 150 units. So you'll need, again, 2 powders, and you just lift the top up of the vial of both powders. It actually just lifts up really easily. And then lift off the top of one of the liquids. The liquids are just a way to dissolve the powder. There's no medication in here. It's important you use this liquid, but don't worry, you'll probably have some liquids left over. The next step is to take a Q cap. You may not have ever seen one of these before, but you just open up the package, and there's a little device that's in here that will just slip right onto the top of the ampule of the vial. So take the vial of liquid and just snap the Q cap right on top, just like that. Next, you'll take a syringe that will be provided with your medications, and it just screws right on top of the Q cap. Then the pretty cool part begins. Just draw back about a cc of liquid. If you get some air in there, that's okay. We'll have plenty of time to get that out. Once you get the liquid into the syringe, take off the syringe and the Q cap as 1 unit, and that has all of the liquid that you'll need. Next, you'll take the first vial of powder, attach the Q cap, squirt in all of the liquid, swirl it around a little bit, but it dissolves very quickly. Turn it upside down and withdraw that mixture. Now you have 75 units in the liquid in the syringe. Then take the Q cap and the syringe off as a single unit again, and put it on to the second powder. And it just snaps right on. Squirt in the liquid, swirl it around a little bit to make sure it's all dissolved, and then draw up that mixture. After that's in there, you have both of the ampules of powder, the vials of powder, in the syringe. Just unscrew it, and you're ready to put a needle on the top of it. And you can just take the tiny little needle right out of the package, and similarly, it'll just screw right on the tip of the syringe. And it's ready to give. When you give this injection, you might first want to take an alcohol pad and just swab the area that you want to give the injection. Then take the needle off, take the cup off the needle, bunch up the tissue, insert the needle straight in all the way, and then just push the medicine in. Release the plunger, wait a couple seconds, pull the needle straight out. If you need to, you can wipe the area with the alcohol prep and apply a bandage if you have a little bit of bleeding. But just like that, you've given your injection of Menipure. So perfect. How easy was that? I think most of the time when I prescribe this medication, the patients will take everything out of the box and take a look at it, and they're thinking, oh my goodness, it's going to be like a science project. But really, it's so easy. Remember, the liquid that comes with it is just to dissolve the powder, and your provider will help you decide how many of the powders is the right dose for you based on what strength they want you to have. 1 powder is 75 units. 2 would be 150, 3, 225, 4, 300, and so on. So I'd like to open it up now and see what questions y'all have for me.
Hey, Karen, how's it going? All right. So we do have a couple of questions, and just a few reminders for everyone out there. Again, you can either click on the Q&A or chat if you're joining us via Zoom, and then just write into the Facebook chat if you have questions on Facebook as well, and we will get to everything. So this question just came in, and I know, Karen, you touched on this a little bit in the beginning, But just to give a little bit more breakdown for people out there. So the question comes in, how does Menipure work? Is there a reason why I would use Menipure instead of FSH alone? I've heard you can do both.
You're exactly right, Craig. You can do both. And sometimes your healthcare provider may prescribe you to take the HMG, the Menipure, plus one other medication, either Gonalef or Follistim. The reason for that is because there's the extra medicine, the LH, that's in Menipure. So in times where certain providers believe that if you give an antagonist, that maybe you need a little bit of LH, or for women that are real thin, you may need a little bit of LH to help the FSH work well. Again, your prescriber will tell you exactly what's right for you, but there are a number of indications that this can be used. Sometimes it's going to be based on what your insurance is going to help to cover. So the folks at Mandel's will help you work that out.
Perfect. I appreciate the shout out there. Yes, that is true. That is one of the things that we are here for, is to be able to work through some of the questions you have around about financial options as well as coverage and so forth. So thank you very much, Karen. So another question that came in, and this is a little bit more when you were discussing the Q-cap, just how the Q-cap works. And this question is, I don't know, maybe this is a hypothetical or not, I'm not sure, but it says, let's say if something happens to my Q-cap, am I able to mix and inject without it, or do I have to use the Q-cap? Would I need to get a new one?
That's a great question as well. I tell you, years ago when Menipure first came on the market, I happened to be friends with some of the people on the team, and they were asking me what the hardest part I thought about administering the medicine was. And at the time, all the medications had to be reconstituted, the powders dissolved in water, or the sterile liquid that comes with it. And so I asked a bunch of my patients, and they were really intimidated about the mixing, much more so than they were actually given the injection. The needle's quite small, as you could see. So they were worried that they wouldn't mix it right, or they wouldn't get the right amount of medicines, or do everything just perfectly. So originally it was used with a needle and syringe, and you can still do that if you don't want to use a Q-cap. Some people might feel more comfortable, especially if they've ever given a medication before. Basically, the Q-cap takes the place of a reconstitution or a mixing needle. So if you don't have a Q-cap, you lose them, you forget them wherever you are, and it's time to do your injection. You just use a needle, put it inside the liquid, withdraw a cc, then take that same needle, put it into the rubber stopper of a powder, squirt in the liquid, draw that out, and either administer it, or if you need more than a single vial of the medicine, then you can just repeat it just without the Q-cap. Personally, I think the Q-cap is pretty genius. I think it makes it so much easier. Sometimes from time to time, I would see patients stick themselves with a big needle because they were nervous when they were mixing everything up. So the Q-cap just keeps you from having to come in contact with yet another needle. So you can do it either way. I personally like the Q-cap, and I found that patients really like that as well.
And great. Yeah, actually perfect. As you were saying, one of the things about this whole program is we're just trying to make everyone feel more like a pro with all of this, and to really feel comfortable. So by the time you're giving that shot, you've gotten rid of any nerves, any questions, any concerns you may have had up front. And so these are the types of questions we love, or like, different ways people want to know what does work, what doesn't work. Just because when you're ready to give that shot, you want to make sure that all that stuff has been taken care of. So thank you, Karen, for letting everybody know that you have a couple options there. But the Q-cap is definitely pretty great. People should, at least give it a shot and try. Oh, no pun intended. That was actually not intended. All right. So now, speaking of drawing in and mixing the liquid, a question came in, and we get this actually quite a bit. And this question says, I've read on blogs that adding potentially more or less liquid can help when I mix my Menipure to help with the injection, make it hurt less. Are either of these true? Is it safe to do? I don't want to be somebody that's self-administering or making up my own rules as I go.
Great questions. The Menipure medicine is in the powder. So the amount of liquid you use really doesn't affect the dosage that you're giving, as long as you use the correct number of powders. So the short answer to the question is it doesn't matter at all how much liquid you use. The little bit longer answer is this is just going into the fatty tissue. As I showed in the video, it's either going to be in your belly, your outer thigh, perhaps the back of your arm, and you don't want to put a huge volume in there. I tell patients they can use 1 to 1.5 cc's. There's really no advantage to using more than that. Sometimes, especially with the higher dosages, it may sting just a little bit just while you give the medicine. It's not a painful injection. It just may be a little bit of a sting. And if you add just a little bit more liquid, that might dilute it a little bit more, especially if you're on like 3 or 4 vials of the medicine a day. Generally, 1 cc works perfectly. But as long as you get the right number of powders and you dissolve it in some liquid, the actual amount of liquid is not that critical.
Great. And actually, the next question that came in just jumps right back off of that, talking about powder. And the question says here, does it matter if my Menipure looks a little bit like a solid tablet or a pill or something like that, as opposed to powder? Will that affect the mixing? Does that mean there might be something wrong with my medication?
It is very unlikely that anything's wrong with your medication. Depending on how it's stored, the shipment, sometimes it can settle and it looks like a little pill at the bottom of the vial. Or if it's been shaken up a little bit, it may look a little bit more like a powder or even somewhere in between. Honestly, as long as you put the liquid in there and you hold it up and it still looks clear, you don't see a lot of particles floating around, or the liquid doesn't look discolored once you mix it, then there's no problem at all, whether it looks like a little pill or if it looks more like powder.
Perfect. Again, like we said, a lot of times people are just looking for those little things. Sometimes you go on Dr. Google and you read about something and it could add a little bit of, a little bit of a concern. And that's why these types of programs are great, where you can really get the real answer and you can really put those questions to bed, so you don't have to worry about them when you're ready to actually inject. So again, as of right now, Karen, we are all caught up with all the questions. I know sometimes people have questions based on the last question. They think of an add-on or something. So we'll give everyone another 30 seconds or so to try to get any last questions in there. And just a reminder that you can, at the end, we'll have a time to answer or ask questions about all 3 of the products. So don't feel like if we move to the next product, you lost your chance. We will be here. But for right now, Karen, I'll kick it back over to you while we give people another 30 seconds or so.
Perfect. I think when patients are giving the injections, I think one of the most important things to do is just to set out all your supplies at the very beginning. So, for example, with a Menipure injection, go ahead and pull out the right number of powders that you need. Get a bottle of the liquid, have your Q cap, have your needle that you're going to put on to administer it, your alcohol pad, maybe a bandage if you think you'll need that. Any of the supplies that you think you might need. I think it's helpful just to assemble all of that at one time, so it'll move just like clockwork and be very reassuring as you start to prepare your injection and administer your injection. Just have all your supplies right there and ready. Sometimes people give these themselves. I would say that most of my patients that take the injections that go just into the fatty tissue, such as Menipure, will self-administer these medicines. Others want their partner to be a part of it as well, so they'll have somebody else do it. I think it's nice when couples do these things together and they can kind of share in the entire process. But always assemble your supplies first. That's my biggest word of wisdom. Any other questions?
We are actually all caught up right now, so we will get ready to move on to the next product. But again, remember, if you have any questions that come up based on Gonalef or on the Menipure discussion, you can bring that up as we move on to the next program here. And so, but other than that, we are ready to move on to the next product whenever you're ready.
Okay. So the next product I want to talk to you about tonight is progesterone in oil. Just saying this to fertility patients kind of bristles the hair on the back of their neck just a little bit, because everybody hears horror stories about progesterone in oil. It is in oil, so it's thicker than, for example, the Menipure or Gonalef or Follistim, but it can be very easy to do as well. The most important thing is to make sure it gets into the muscle. To do that, you need a longer needle and you want to make sure you give it in the right place. So we'll go through some of these things. Craig, if you want to go ahead and cue up the video, we'll make this very easy for you. It's amazing to me how many of my patients come back and say, oh, I was so worried about taking the progesterone injections, but they're actually quite easy. As he gets the video ready, I'll tell you that there are a number of ways you can administer progesterone. You can take it vaginally. There are some oral formulations. There are vaginal gels, suppositories, can be compounded, or you can give it in injections. I think what is widely accepted now is to use progesterone in oil. There have been a number of studies showing that patients that have done IVF, that is the preferred route of administration. Your provider, again, will tell you what they think is best for you. So Craig, go ahead and start the video and we'll answer some questions on the other side. Your healthcare provider has recommended that you take progesterone in oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone in oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol. But with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to one line or two to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it just one time. We know you're already clean. Just wipe it one time, separate the tissue, remove the top from the needle, put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil. So how easy was that? You know, I think when people are prescribed progesterone and oil to take, they're worried about the length of the needle. It's so important that the needle go all the way in, directly into the muscle. Another thing I wanted to bring up to you is exactly where to get it. I know I showed you the little graphic in the video, but if you look again on this graphic, you can see that if this is the hip, you want to go way up in the corner. People tend to want to go right in the middle of the hip where they think they've got the most meat on their bottoms, and they want to go right in the middle of that just because it's a long, intimidating needle. But you want it to go in the muscle. God's blessed all of us women, most all of us women, with a little padding on our backsides, and that padding is just fat. So people that have had some irritation or some redness or lumps or heat to that area after giving progesterone injections, it's probably because it's leaked into the fat. What I do in my program when I tell a patient to start taking progesterone, for example, after their egg retrieval, I have patients start their progesterone the next day. That's provider dependent. But I will take out a Sharpie or a skin marker and just draw right on their hips. I'll draw parentheses so they'll have a target to know exactly where to do it. Once that target's there, the spouse or friend or family member or partner can just put that needle straight in right into the target. And that gives a little bit of extra reassurance. Again, for most people, it seems like it's a little bit higher and out to the side, but you want to stay away from the mid portion of the hip. It goes a bit higher than that. If you just put your hand on your hip bone and have this part of your hand on your hip bone, and then rest your palm back, it's going to go underneath your palm. So I'll open up now, Craig, for questions and see what else I can tell you to make this really easy.
Sounds good. Well, first off, thank you so much for making that so easy and getting out ahead of some of these questions, which is pretty great. The first one that came in is, we get this pretty often, just about all the products, and I always like when we start off with something like this, but it just is, what's the purpose of using progesterone in general? How does it help me to get pregnant? How does it help throughout the cycle?
Great questions. You know, I think it's important that patients undergoing this treatment have a little bit of a physiology lesson. You know, you probably didn't want to pay that much attention to this when you took physiology in high school or in college, and now it's coming back to bite us, literally having to go back and remember what these hormones actually do. After a woman ovulates, the leftover sac that the egg was in becomes a functioning gland. And just like every other gland in the body, the functioning gland, the corpus luteum, it's called, the hormone it makes is progesterone. Sometimes when we're undergoing particular fertility treatments or in certain medical conditions, not enough progesterone is going to be made by that corpus luteum. For that reason, progesterone is given. The most common reason progesterone and oil is given is for patients undergoing in vitro fertilization. So why would this be important? When you have an egg retrieval, the needle is placed into each follicle and the fluid is aspirated into a little test tube. From there, the egg hopefully will flow into that fluid and come out and end up in the test tube too for the embryologist to identify and to do the process of in vitro fertilization. Well, once that fluid is removed, sometimes the corpus luteum is going to be inadequate and not make enough progesterone. So we add a little supplemental progesterone with the progesterone in oil or perhaps by another means, and this will help to sustain a pregnancy. Estrogen causes the lining of the uterus to build up. When we take medicine such as the Menipure that we talked about, or Gonadotropin or Follistim, it increases estrogen levels from the developing eggs, and the estrogen in turn makes the lining of the uterus thicker. Progesterone, on the other hand, stabilizes it, and that's exactly what we want to happen so that a pregnancy can implant. Once the embryo makes its way to the uterus, it can implant and continue. You want that endometrium nice and quiet and stable. So that's the purpose of progesterone. Now, progesterone in oil is generally in sesame oil or peanut oil. There are lots of people out there allergic to various oils. Fortunately, at Mandel's, they can compound your progesterone so it can be in an oil that will be more friendly to your body. The most common one I see is olive oil. Sometimes I'll write that for patients that are allergic to sesame seeds or to peanuts. There's another formulation called progesterone and ethyl oleate. It's a little bit controversial about whether it's just the same as the traditional progesterone in oil, but it's much thinner than the progesterone in sesame or peanut oil. So that may be something you want to ask your provider about. Do they recommend that one for you? Another thing you can do, especially if you're intimidated by taking these injections or you worry that it's going to be uncomfortable, is there's a little patch that looks kind of like a Band-Aid. It's called a Sonera patch, and it warms and numbs the skin. You put it on like a Band-Aid right where you're going to give the injection about 20 to 30 minutes before you do the injection. Patients that use this love it. Sometimes insurance covers it, sometimes they don't. I tell patients personally, if their insurance covers it, I think it's awesome. If their insurance doesn't, they need to think about whether it's worth the $10 a patch to do it. My recommendation, give it a whirl, take the injection. I think you're going to be pleasantly surprised and relieved how much easier it is than you could have ever imagined. What other questions do we have, Craig?
That's actually great, because then the next question kind of builds a little bit off of that. And so somebody mentioned it there. This may again have been a personal experience or just something somebody read about, but it says, is there anything I can do to prevent welts from the shot? Will some of the pain patches help with dealing with that? It seems there has the potential to be pretty uncomfortable and itchy. So I'm just trying to figure out ways to get around that.
Yeah, that's a good point. And it does kind of build on what I was saying before, is that the times that you're going to have that itchiness and welts and irritation, it's a form of cellulitis. So just the inflammation of that fatty tissue. Putting fat into fat is just not a good combination. It's not going to, it may be absorbed as well, but it's sure going to cause some issues. So what I tell my couples when I'm talking to them in the office, that I always have patients who are thinking that they love their spouses more than anybody else loves theirs. So they're not going to put that needle in quite all the way just because it's long and intimidating. So they're just going to put it in a little bit. Those are the patients that are going to have the welts and the irritation and the redness, the heat and tenderness from doing their progesterone injections. The ones that really love their spouse the most just get bold. They put the needle straight in, just in a quick movement, put the needle straight in to make sure it gets into the muscle, give the medication, and I can promise you that you're not going to skip a beat if you do it just that way in the right location. Never hesitate to ask your provider to draw a target and make sure the needle goes all the way in.
Great, thank you. And I just feel like for most of quarantine, I feel like I've just been putting fat into fat myself. So thank you. Thank you for reminding me that that's always bad, not just with injections. So here's a quick question, and this just came in that asks, so you talked about how progesterone works, but how long will I be taking progesterone?
Great question. Your provider is going to tell you exactly how long to take it. In my program, I generally stop it at 6 or 7 weeks. If it's with fresh embryos or with a fresh a cycle where you're just taking other medications, most of the time that I write for it is for IVF. So if you're doing a fresh IVF cycle, I'll tell people to take it to their 6 or 7 weeks. For frozen embryos, I will have patients take it to their about 9 or 10 weeks. Now, every program is going to be different. Everybody's got their own secret sauce of how long you should take it. So do talk with your provider about it. I base what I do on what's called the Ludio placental shift. When the corpus luteum kind of plays out and the placenta takes over. There was a study that was published years ago that said you can even take somebody's ovaries out at about 8 to 9 weeks. So there's no point in continuing it beyond that. It's interesting, though, what I have found is that people don't want to stop it. It's a nice little crutch and everything's going so well. Why stop taking the progesterone? What's going to happen? What tragedy is going to happen when you stop it? So take the advice of your healthcare provider. Sometimes they may be willing to change it to a vaginal progesterone preparation after you get to a certain point. My thought has always been that you should take it at least until your positive pregnancy test, and then if you're really having a problem with it, we can change it to a vaginal preparation. Most of the time, people want to just keep right on with the IM injections.
Great. Thank you very much. And thanks for sharing a little bit about what you do. And then also reminding everyone that part of the program here is that we really do we'll try to answer any question we can, but we really do want to make sure that, some of these questions are great to get this information and then go back and speak with your healthcare professional about how they want to do it. And there's little changes that can take place, but we're always going to try to answer any questions we can, such as this one, which came in that says, and I know you spent a lot of time talking about the intramuscular part of all this. And so we understand that part, but this just a more generalized kind of high level question of why exactly is this shot intramuscular instead of being just like a sub-Q shot? Like, what is the difference in the way that your body needs to absorb?
Great question. And the reason for that is because of how it is delivered. You can't inject the oil. You shouldn't inject oil into the muscle, but it's better absorbed in the muscle as well. There are some products that are out on the horizon that hopefully will be approved in the next few years that hopefully will make this a lot easier. There have also been some things that some of my patients have done that I'd never even heard of. There's some auto injectors you can get online that some patients use, and they feel better about using an auto injector from Amazon to give their injection, and they'd rather do that themselves with the auto injector than to have their spouse do it. So that might be something else you want to think about. To be honest, I should probably go online and take a look at those. But patients are in blogs and on Facebook support groups, and that's a hot thing they're talking about right now.
Yeah, thank you so much. Yeah, and this is what we're trying to do, is be a part of this larger community that is out there, and there are ways to find out information from people. Many different blogs and things like that. But also, we're glad that you came here tonight to PharmAssist and with Karen to be able to ask some of these questions as well to get some answers. So speaking of questions and answers, we have wrapped up what we have so far. So again, I'm going to give another 30 seconds or so for everyone. If you have you're trying to figure out how to get it down into the computer, go ahead. Don't worry. There's no rush. I'm going to kick it back over to you, Karen. If you want, you can, just share anything as we get ready. Give another 30 seconds or so for people to start moving on to the next product.
Perfect. So just a few little highlights about the progesterone in oil. If you're allergic to sesame seeds or peanuts, be sure you tell your provider so another formulation can be ordered for you. You want to make sure that the needle goes all the way in in the right spot. Don't hesitate to ask your nurse or your provider to draw some targets to make sure you take it at just the right place. And I tell people to take it about the same time each day. And I hope to hear back from you through this site or through others, and definitely to your providers, that it really wasn't as hard as you thought it would be. And when you give it deep in the muscle, you're not going to have any local reactions.
Yes, we definitely love those types of comments. So please let us know how it goes, and come back and join us on Facebook. You can reach us just by coming over to our page itself. But we do have a number of ways, and we love to hear those stories. So thank you so much, Karen, for reminding us. With that being said, we are all caught up with questions. We will get ready to move on to the next product. And of course, you always have time at the end to ask any questions about any one of the 3 products we discussed tonight.
Perfect. So the next product that I want to talk to you about is kind of going backward just a little bit, but it's called Ovidrel. Ovidrel is a type of HCG. It's made in the lab as opposed to being human derived. Ovidrel takes the place of doing HCG. And the purpose of this is that it mimics the LH surge. So we talked about a little bit earlier about the estrogen building the lining of the uterus. Then all of a sudden, then progesterone stabilizes it. But once the estrogen gets to a certain point in a spontaneous cycle, it should trigger a little bit of progesterone and then a huge surge of LH. Sometimes when we give fertility medicines, that LH surge won't happen. Sometimes it's because we have given you other medicines, such as a GnRH antagonist or agonist, to keep it from happening. But nevertheless, we want you to ovulate or be ready for your egg retrieval at just the right time, so we can give a formulation of HCG. So Ovidrel is the newest version of HCG that's available, and it's given subcutaneously. The cool thing about this is that it's already pre-mixed. It's very easy to give. Craig's going to go ahead and cue up the video, and we'll show you just how easy it is to do, and then we'll answer some questions on the other side. So Craig, if you want to go ahead and start that video. I'd like to talk to you about administering Ovidrel. If your prescriber has recommended you take Ovidrel, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Ovidrel comes in a little package like this, and you simply open it up and remove the inside part like that. Fortunately, with this medicine, it's in a pre-filled syringe, so the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Ovidrel. So really, how easy is that? It can't get much easier. It's already drawn up, already got the little tiny needle on there. You just take it out of the package and give it. Another alternative place to give the injection is the back, the fatty part of your arm. Any of these places, basically any place that you can pinch an inch is a good place to do it. But I found that patients tolerate the medicine so well by giving it in their belly. So I generally recommend that patients take it just beneath the belly button and out to the side a little bit. So Craig, what questions do we have on this?
So one came in, and I'm not sure if this was motivated by something that you had said earlier, but a question comes in that says, if I happen to see a bubble in my vial, is it dangerous? If so, how do I get rid of it?
Great question. I grew up watching General Hospital, and I always thought that was a quick way to kill somebody is to put some air into a syringe into medicine and give that injection, and it was sudden death. But only after I went to school did I find out that that is only in soap operas that it's sudden death if you get an air bubble into the medicine. Actually, a little bit of air is not going to matter, but if you don't like it, you really want to get it out, there are a couple of things you can do. One of them is hold the syringe so that the needle is pointing straight up, and then thump just a little bit, just gently, the syringe, and the air bubbles will rise to the top. Then you can depress the plunger just a little bit. Personally, I try not to get the medication on the needle. By getting the medicine on there, I think that it might cause a little bit of discomfort. Most people probably wouldn't give that a second thought. Another thing that you can do if you don't want to thump the bubbles up, you can just pull back on the plunger and let a lot of air in there, and that just pulls all the air up to meet it. And then push. I like to leave just a little bit, but you can push the plunger back up just till you see that the fluid is at the top of the syringe, just right at the hub where the needle screws on. Again, if a little air gets in there, it's not going to cause any problem at all.
Great, thank you. I think A, putting people's minds at ease regarding the idea of the bubble itself, but then B, also, hey, if you really still want to get rid of it, here are some ways to do it. So that's great. Thank you so much for that one, Karen. Now, this one, I know you've actually answered this before on previous programs. We've talked about this. It comes up quite a bit. But I think specifically because of the timetable aspect that's associated with Avidril here, just the question that comes in that just says, what kind of a window do I have for giving my shot based on my nurse's timetable? Is it minutes, seconds, an hour? I just want to be sure that I don't mess this one up. I want to get it right.
Great question. And your provider is probably going to tell you, take your HCG or your Avidril at exactly this time. And so sometimes people will watch the clock and have the needle in the syringe in their hand, ready to administer the medicine as soon as they see on their digital clock that the time clicks. I don't think you have to be that specific, but you want to be pretty close, within a few minutes, I would say. The reason for that is we don't want you to take it too soon, because the HCG, whichever form it is, not only does it prepare your eggs to ovulate, but it also does the final maturation. I had somebody just last month who the husband said, he didn't say it out loud, but he said in his own head, gosh, I really am afraid she will ovulate. I don't want her to ovulate before we have this procedure. So he didn't give the entire dose of medicine. Unfortunately, when it was time to do her egg retrieval, we didn't get any eggs because he just gave her a very tiny amount of medicine. It wasn't enough to do that final maturation of the eggs. These medicines come in a particular dosage for a reason. And we want to make sure that it's enough to do this final maturation. Now, you don't want to wait too long on the other side and be late taking your injection, be early taking your injection, because you don't want to ovulate before your procedure is scheduled. If you're planning to have an insemination or perhaps IVF. So there is a narrow window. Most providers will say it needs to be 35 or 36 hours before your procedure is scheduled. Now, if you get to your appointment and your providers are running a little behind schedule, as all too often that happens, and you think, oh my goodness, I'm going to ovulate. Actually, it's probably going to be close to 40 hours, maybe even a little bit longer before you would actually ovulate. But we start getting a little bit nervous if it's been 37 hours. So we give you that specific time because we want the eggs to be perfectly mature, but not already released. don't stress too much over this, but if you can get it within 15 or 20 minutes on either side, I think you'll be just fine.
Thank you very much. We appreciate the answer and the candor around that. And really what we all learn is if your nurse or your doctor gives you an actual time, you should probably try to stick to it. There's a reason why they're saying that and not saying that for every other medication. So thanks for putting that out for everyone to understand. And then it actually led to this follow-up question that came in and says, so now what are my options if the timetable is missed and based on my personal schedule, is my entire whole cycle wasted?
Gosh, that is a big question. If you miss taking your medicine, or if you take it at the wrong time, too early or too late, I would recommend as soon as you realize the error that you contact your healthcare provider at once. That is an acceptable after hours call. All calls I think are acceptable, but never hesitate if you think you've done it wrong. I had a patient a couple of years ago who took her HCG off by 12 hours. And I was able to assemble my team and we did an egg retrieval at 10 at night. Sometimes that can't be orchestrated to get everybody there just to salvage the cycle. Sometimes it might mean a delay in doing your cycle. I also had another patient who said, gosh, you told me to do it at 35 hours, but I really thought you probably meant like the day before. So she took it at 24 hours and we delayed her cycle, her egg retrieval. Sometimes if you take it way too early, all will be lost and your cycle would end up canceled. So the most important thing you can do, if you realize you've made an error in the time, go ahead and contact your healthcare provider right away and see what you can do to try to make sure everything gets back on schedule if possible. Great question.
Thanks for that answer too, just to show that there is some wiggle room, not a ton. You don't want to rely on that, but I think it's also just it's heartening for all of us to hear that situation that you talked about everybody being able and willing to pull together to make it work. Does show a lot of the stuff that's happening behind the scenes in these clinics that you may not be privy to, just to know what goes into this. So thanks for sharing that story. We appreciate it. So this next one actually comes in, and I'm not sure if it has anything to do with having listened to the progesterone and oil one already or not, but the question just came in. It says, what options do I have again for where to give my Ovidrel injections? My belly needs a break.
Totally get it, especially if you're taking several medicines, a couple of medicines, maybe Menipure and either Gonadotropin or Follistim, and you've done this for a number of days, your belly is getting tired. You want a different site. First and foremost, it's not going to hurt you. Even though if you're sore and you may be bruised a little bit, it's not going to affect the absorption to still give it your belly. If you have a little irritation someplace or perhaps a welt or something, very uncommon with these medicines. But if you do have it, you just want to stay away from that area. On the other hand, you can give it in the outside part of your thigh. I don't know if the light is going to be, let me show you this or not. So the outside part of your thigh, right in here, your belly, as I said, or you can give it in the back of your arm. And you can still do that to yourself if you'll just kind of sit sideways, let the back of your arm rest up against a table, and then just put the needle straight in all the way. Basically, it's wherever you can pinch an inch. It's likely going to be okay to do it. Taking these medicines, it certainly takes a lot of dedication. You want to achieve your goal so badly, and you want to do everything perfectly. And it can be very intimidating. But there is an end in sight, and you need to keep your eye on the prize. What other questions, Craig?
So I think we are all caught up right now with the questions. Let me just take a quick look. Yeah, so as of right now, we've gotten through everything. Just as before, though, I think we can give everyone another like 30 seconds or so. We are at the end, so that if you have questions about Menipure or the progesterone, any of the other products that we talked about, you can bring those up now as well. But in the meantime, I will throw it back over to you, Karen, and then we'll get ready to wrap things up.
Perfect. Well, I hope tonight has been useful for you. I hope that it has shown you that, yes, you can do this. It is easy. All of these videos are archived too. So it's nice. You can go back to My Mandel's Pharmacy at any time, or to some of the social media sites like Mandel's Facebook page or my Facebook page, and you'll see these videos that are stored, and you can even do it like a workout video. So as we demonstrate how to do this medicine, you can mix yours up right alongside it. And before you know it, you're going to be the pro teaching people how to do it. You'll be the cheerleader in the waiting room at your practice saying, oh, here's what I did, and this is what works for me. It's also really helpful if you find something that we didn't say, please let your provider know, because we want this to be for everybody. And I think we can all learn a lot from each other. Anytime that you have any questions, reach out to your healthcare provider, reach out to the folks at Mandel's. We work together so nicely to try to make everything as easy as possible, because the only people that want you to have a baby as much as you do as us, we really do want to help you to achieve your goals and your dreams.
Awesome. Thank you so much, Karen. I just want to say thank you for everything tonight, and for all your time and your expertise and your stories and all of that. I think it really does help people to realize that there are, there's other people behind the curtain there trying to help you get pregnant. And that's why we're so excited to do these programs, to bring all three of us together, patients, bring physicians and HCPs, nurses, and so forth. And then obviously us on the pharmacy side, the kind of triumvirate of helping to get you pregnant. So thank you so much, Karen, for your time and your expertise. Thank you to everyone once again who joined us, whether you came via Zoom or you came on Facebook, for all of your great questions that you had. They were all excellent. And we hope you really learned something tonight. Our goal is to make it be, as Karen said before, so that when you sit down, you're ready for that shot, that you've gotten out all of the questions that you may have needed beforehand by coming on here and talking with us and asking these questions live. So thank you so much. And we'd love to hear some of the stories of how things go once you leave the PharmAssist world and you go on and proceed with your cycle. Do not forget, as Karen mentioned, that all of these full virtual learning experience videos called VLEs as well as all those individual product demonstration videos. You can find them on demand on YouTube, on Facebook. You can find them on our personal page, which is mymandelsPharmacy.com/PharmAssist. We look forward to seeing you all here again next Monday night at 7 p.m. Eastern Standard Time, just like we are every Monday night, for another great program with another great speaker. As you probably know, in 2020, one of the best ways for the word to get out there is to share. Let anyone you know, if it's a friend, a family member, a colleague, somebody who you think can benefit from this program, share it with them, let them know all about it, and let them know to bring their questions and share it with another friend as well. Once again, my name is Craig Orapello. Thank you so much, Karen Hammond, for joining us tonight, and we look forward to seeing you all here again next Monday night on the PharmAssist program. Have a great night. Thanks, Karen.
Thank you. Stay well.